Hi, this is Dr. Buford. Nadine. We're just getting started in the right shoulder. We're looking from the back to the front. Everything you see is magnified 30 or 40 times on the screen. Okay, so what you see here is we pass the stitch through the biceps once. We're going to do it one more time, right above it. The reason we're doing this is because it's loose right at the base here. See, as I use my cannula as a probe, that's loose. And so we're going to do this soft tissue biceps tenodesis is what we call it. And now we're going to pass a black wire called the shuttle relay through that needle. We'll show you since I think we did the first one and didn't record it. A little bit of luck. In just a minute. There it is. Grab the relay, pull a little bit more into the joint like that. Okay, very good. Pause. Now retrieve the relay on this side of the biceps here, as you see. And then we're going to load the stitch into the relay. And then as we pull back this time, now we have a good hold on that biceps tendon. So we're going to go ahead and release the biceps here. Very good. We're going to look here at the subscap. Looks like there's a little bit of tearing or something going on here. Like it is leading edge of the subscap. You weren't weak at all clinically, and this is just a very small amount of fraying on the superior edge. We're going to have a good look at it here and decide if we need to do anything about it. There's the split right there. So externally rotate down towards you. So the subscap is firmly attached. I can't displace it at all, but we do see that little split in it. So we'll take a number 1 PDF, just pass a stitch across it just to secure it. We have a loop of an absorbable suture around this little split in the subscap. This isn't really, this might be a little bit overkill, but since we're here, it's pretty easy to put a stitch here just so this tear doesn't get any bigger. Okay, so we're going to tie a sliding knot here and see if it doesn't help us close down this split. We've got the stitch passed and tied in the subscap. You can see it right there. It looks good actually. See how that's got that split closed up? Happy with that. We're going to rotate the eye of the camera down. That looks good. You've got some maybe grade 1 or 2 changes in the socket down below. Not too much going on in the back. That looks pretty good. That anatomy's checking out. And the good news is, at least on this side, the rotator cuff looks okay. You may still have a bursal-sided tear, but at least looking on this side, which is the articular side, there's maybe a little bit of a split. See right there? Let me get a marker stitch. A little bit of a split right there, but man, that's just almost microscopic, so I'm happy. It is fine. I'm happy that that's not a complete tear. Hold this cannula, this shaver down. So we're going to pass the spinal needle right through that area. Pass just a little behind the area that's torn, so that way we'll be able to know exactly where that is. We're going to go off on the video now, okay? Let's change. Okay, so we're up in the subacromial space. We're almost done here. We have a couple more things to check out before we are done. We've taken off some bone here to make sure there's plenty of room for the rotator cuff in the front, and that looks good. We're going to look down and try and find that marker stitch. This is the muscle of the rotator cuff right here. And then as we pull back, we ought to be able to find that marker stitch in just a minute. There it is right there. And so we're going to go ahead and pull the marker stitch out. Okay, and now we'll just take away some of the bursal tissue over the cuff to make sure there's no tearing here. Remember that marker stitch is a little behind where the tear was inside the joint, so we're going to look a little bit anterior as well. Basically in this region here. Okay, so this is actually starting to look like good news. I don't see any significant tearing in the rotator cuff. We will rotate here and make sure. So there's internal, there's external, and that cuff looks good, so that's good news. It's inflamed a little bit. You can see the redness, but no significant tearing. The one thing we have left to do is to take care of those blue and white sutures that you see right there. Hold the camera. And that is where we're going to be doing the biceps tenodesis by tying those sutures down. Okay, so now we're going to go ahead and tie these final two sutures. This is what we call a non-sliding knot. I'll just run the video and keep the knot in the middle of the screen so you can see what we do here. A lot of times we good. We have one more half hitch to tie. There it is. And now we're going to cut the suture tails and get you back to the recovery room. So I really hope this does the trick for you, okay? Good luck to you now. Bye-bye.